it's Hannah here from Physic Health Consulting. Today I wanted to talk a little bit about how to prepare for a hysterectomy, because the better prepared you are, the easier your recovery will be, and I know a lot of women want to know a little bit more about that. So it depends on a few things, really. There's always something you can do, but what you can do depends on a few things. First of all, how long you've got between now and your surgery. What kind of surgery you're having. Are you having a full radical hysterectomy where they're going to take your ovaries, or are you having partial hysterectomy? And what the reason is for that hysterectomy. Very often the reason is linked to high levels of estrogen, and there is a lot we can do to help get that a bit more under control. I have actually even had ladies who have come to me for herbal medicine to prepare them for hysterectomy, and the herbs have sorted out whatever the problem was, and they haven't needed that surgery after all. Usually that's when they have quite a long wait before they go in for their surgery. So a lot of women think that recovery is going to be fairly quick and easy, and a lot tell me afterwards that they'd underestimated that. The recovery has taken longer than they expected and they were told it would. So that's one thing to take away. Be prepared for quite a lengthy recovery. It's major surgery, and particularly if you're having your ovaries taken out and you're going to be thrown into menopause as well, you need to bear that in mind. So put measures in place now to help you have the time and space that you're going to need to recover. That might mean, if you're able to, getting some help around the house, getting some help with childcare, making sure your employer is able to support you if you need a little bit more time off work than you first thought. Also, you need to make sure that you're as fit and healthy as possible before you go in for surgery. So a lady who can really help you with that besides me is a lady called Jeanette Brown, and she specializes in improving your core strength. A lot of women think that because they're going in for hysterectomy, they don't need to bother with making sure their core strength and their overall fitness is in place, but actually the opposite is true. The fitter and the better condition you're in before you go in, the easier your recovery will be. So she runs a company called Core Restore by Jeanette, and I can put the link to her site below. In terms of what we can do on the physical level, obviously if you're having your ovaries removed, we can hopefully help to buffer that sudden menopause that you're going to be thrown into beforehand. However, we don't always get as far with that as we would like to. It's not that you would take the herbs and you'll have no menopause symptoms at all if you're having your ovaries removed. They might be better than they would have been otherwise, but really the time to really go ahead with the herbs is after the surgery and after you're out of hospital. And then there's a lot we can do just to help your body to cope with that shock and help it to rebalance again afterwards. We can also help you to deal with the stress, both leading up to surgery and afterwards. So there are some nice herbal adaptogens and nervines that we can use. There are also herbs that we can give you that will help to get your immune system fighting fit to minimize the risk of infection happening, because that's not something we particularly want either. With the herbs, we generally recommend that you come off them a few days before your surgery, just to minimize the risk of it interacting with any other medication that you might be taking. On the more emotional level and the psychological level, if you are really frightened at the prospect of going in for surgery, and some women really dread this, understandably, we can use hypnotherapy both in the sessions that you would have with me, but also you would have some techniques that you could use even immediately before surgery and immediately after, just to help you reduce that anxiety and feel much calmer and more confident about the whole process. So the quick answer is there's plenty we can do. Exactly what we can do and how well really depends on your individual situation. But if you have any questions or you'd like to find out a bit more, feel free to book a free call with me online at www.physichealth.uk. I hope that helps, and I will see you again soon. Bye.